Okay, welcome. We're with our first patient today in our medical suite. So she's 28 years old. She's a beautiful young girl from the Chicago region, and she's got a beautiful face, but she wants her nose to be a little bit more refined, to be a little more narrow, and to get rid of a dorsal hump she has, and to rotate her tip a little bit. And she's also bothered, she's got some bags under her eyes that bulge when she looks around, and she has then some volume deficit and dark circles under there. So we're going to do a rhinoplasty to improve her nose, and we're going to do a lower eyelid surgery to improve the eyelids. And so what we've done the lower eyelid fat bag removal. So I made an incision inside the lower eyelid so that's invisible. Then I moved these fat bags that bulge and cause bagging in the lower eyelids. And then she's got a volume deficiency there as well, all throughout the infraorbital region, which gives, a little bit more of a sunken look and dark circles. So we're going to fill those areas with facial fat grafting, and what we do are these tiny little just sort of access points which end up healing with invisible scars, and then we use fat. So we've harvested this from the abdomen, we've centrifuged that, and then we're going to very strategically place that deep right on the bone in this area called the infraorbital region to provide volume and more softness and filling and smoothness of the lower eyelid. So we've just gotten started. We'll finish the eyes up and then we'll move to the nose. Okay, so we're into the rhinoplasty here, and basically a couple of the goals here. Really, her nose is nice, but she's just got this sort of hump and a little bit of a droopy tip that she doesn't like, and she wants to narrow it some. So what we've done, we're going to do a dorsal hump resection, and then I need to build out her tip to just kind of change those relationships a little bit. So we've done a number of steps here. We've done the open rhinoplasty here, which is an incision across the bottom of the columella, and so that'll heal to be pretty much invisible. And then when we open the nose, we get access to the underlying structure, which is bone and cartilage. So she's got nice tip cartilages here called lower lateral cartilages. What we've done is we've done a dorsal hump resection, and this is the dorsal hump, so that's a little bit of bone and cartilage that was sitting here on the nose, so we can shave that off to lean the nose down. And then the other step we've done is inside the nose. What we've done is a septoplasty. So she didn't really have any issues with the septum, but since I'm going to want to build out the tip, what we did is made an incision inside the nose to get this cartilage, and then I'll be able to form this in graft so that I can make a post called a Columnar Strut and build the tip up. So we're underway. We're now going to do the osteotomies to narrow her nose and then move down to the tip reconstruction. Okay, so what we're going to demonstrate here is just this tip work that we've been doing. So this right here, I don't know how well we can appreciate it, but this is, it's called a columnar strut, but it's a graft that we use from the septum. So we carved that to be basically like a board. And what that does, it comes right up the center nose and then supports these two lower lateral cartilages. That allows us to get some control the position of the tip and to rotate a little bit more, and also to build the cartilages up to make the tip a little more projected. So now what we're going to do is finalize our tip sutures and shaping to help reduce the tip a little bit and get the tip just right. Okay, so we finished up here. You can see when we finished the nose, we've got a great shape. From the front, we're narrowed here. And then with the side profile, we're able to get rid of this dorsal hump and change this relationship so she can have, you know, a nice straight nose here and then a super tip break and then a nice small defined nose. So that went really smoothly. It was about a little over 2 hours for the eyelids and the nose, and so we'll tape this, put a splint on it, and wake her up and she'll go to the recovery room. Really nice case.